Good afternoon, everyone. Thanks for joining us here today. It's a pleasure to welcome you to this pre-application webinar on the NOSI for de-implementation. My name is Wynne Norton. I'm a program director with the Implementation Science team in the Division of Cancer Control and Population Sciences here at the NCI. And I'm joined with my collaborator and colleague, Dr. Erica Breslau, who's a program director in the Health Systems and Interventions Research Branch in the Healthcare Delivery Research Program in the Division of Cancer Control and Population Sciences. Just a brief overview of the webinar. We'll spend about 20 minutes walking through the NOSI and then look forward to answering your questions. Just provide a brief overview of what the actual NOSI is. Some of you may not be familiar with this mechanism that NIH is rolling out more frequently. Go through a background and purpose of the NCI De-Implementation NOSI with some specifications around the research objectives and select research areas. And finally, go with some application and submission information that may be relatively new to you, considering this is a NOSI and the first time this has been issued by NCI. So what is a NOSI? The NIH Notice of Special Interest. It's posted in the NIH guide that institutes and centers, they use it essentially to share and update information about research priorities. And it's able to highlight a specific topic of interest or area of research or program that that institute and or center would like to see more applications in to advance the science in that particular area. The NOSIs direct applicants to one or more active FOAs, funding opportunity announcements, for submission of applications for the particular initiative described. And the NOSIs use the standing study sections. There are no set-aside funds, and they're slowly replacing the program announcements or PAs across NIH. There's a nice detailed information and FAQs on the NIH website there, as well as the notice that was published last year in the NIH guide if you'd like more information. So this particular NOSI, NOTCA 20021, is titled De-Implementation of Ineffective or Low-Value Clinical Practices Along the Cancer Care Continuum. It was issued in January 6th of this year. It only allows for applications that use the R01 mechanism, and it's only supported by the National Cancer Institute. There are a lot of different definitions and conceptualizations of de-implementation and terms such as de-adoption, but for purposes of the NOSI here, we use the definition that it is scientific study of factors, processes, and strategies for reducing, replacing, or stopping the use of ineffective or low-value clinical practices in healthcare delivery settings. Some background about de-implementation. We know that there are a lot of different practices that are ineffective and low value that are being used routinely in healthcare delivery settings. The use of these practices has a negative impact on patients, healthcare providers, teams, organizations, and healthcare systems. And it is quite common among the cancer care continuum as well as in other health domains. Relatively speaking, to date, we have relatively little research on de-implementation of ineffective or low-value practices compared to some other research areas, such as implementation of evidence-based practices. And therefore, we want to have and receive more applications that propose to study de-implementation such that we can optimize patient health outcomes and maximize the use of limited resources. The overall purpose of the NOSI is to highlight interest in investigator-initiated grant applications that propose to study de-implementation along the cancer care continuum, starting from detection through end of life. Studies should generally propose to use rigorous methods and study designs to better understand or drive de-implementation of these particular practices. The overarching research objectives include to broaden and deepen our understanding of de-implementation. And given the current state of the science of this field, we welcome and encourage applications that are both exploratory and hypothesis-driven. We encourage the use of different study designs, either individual or multiple study designs within the R01 application, including observational, experimental, or randomized clinical trials, quasi-experimental, such as interrupted time series, natural experiments, and pragmatic RCTs. We also encourage you to use a variety of research methods as appropriate for answering your particular research questions, which could include qualitative, quantitative, or a combination of both in a mixed method study. Studies must focus on one or more phases of the cancer care continuum, which we operationalize as detection, diagnosis, treatment, survivorship, and/or end of life. You can focus on one phase or multiple phases or processes between several phases. And applicants are encouraged to examine the multi-level aspects of de-implementation to the extent that de-implementation is a multi-level issue, and contextual factors are very important in understanding and driving de-implementation. These are select research areas that we encourage, but certainly applications are not limited to. Exploring multi-level factors, trying to understand the effects that they may have in their association with facilitating de-implementation, understanding and identifying predictors, processes, and outcomes of de-implementation at multiple levels, understanding if and how de-implementation processes, predictors, and outcomes may in fact vary by the type of practice, whether or not it's ineffective or low value, vary by the phase along the cancer care continuum, and or vary by the type of action that de-implementation is unfolding. So stopping, reducing, or replacing a particular practice along that continuum. As with implementation science, we encourage and are interested in applications that propose to develop and, importantly, validate instruments to measure de-implementation processes, predictors, and outcomes, as well as develop and test multi-level strategies to drive de-implementation where appropriate. Walk through a couple issues here on the application process for this NOSI. The notice again is CA 20021, and applicants must submit to one of these 4 funding opportunity announcements. Again, all 4 of these are R01s. And applications in response to this NOSI cannot be submitted to other mechanisms such as R21s or R03s, and cannot be submitted to any other FOAs aside from the ones listed above. A little more detail here on these FOAs. These are the 4 listed here and on the previous page, which will be accepting applications in response to this NOSI. You'll notice here they have different due dates, different titles, and importantly, the numbers here, they're all R01s, and I would pay particular attention to whether or not they are clinical trial optional, clinical trial required, or clinical trial not allowed. If you're interested in more information about whether or not you think your study would be classified as a clinical trial, according to the NIH definition, I encourage you to look at the Office of Extramural Research website and answer the 4 questions that will determine whether or not your proposed study is considered a trial. There are a lot of other resources on those websites as well if you need additional input. This NOSI expires May 10th, 2022. The earliest submission date is this March 6th, but that is only for PAR 18869. These are the specific due dates. That first one is not using standard application due dates, so look at the specific PAR for those particular due dates. And the last 3 funding opportunity announcements there use the standard application due dates, which are noted in the notice. Applicants may submit to any of the reissuances of these 4 announcements through the NOSI expiration date on May 10th, 2022. Application requirements for this NOSI. Of course, with all applications, you must follow the SF 424 R&R application guide and the FOA used for submission. Applicants must include NOT CA 20021 without the quotation marks in the agency routing identifier field, which is box 4B of the SF 424 R&R form, to be responsive to this NOSI. Applications without this agency routing identifier will not be considered for the NOSI, and applications non-responsive to terms of this NOSI will not be considered for the NOSI initiative. Again, I encourage you to work with experts in your Office of Sponsored Programs or the equivalent so that you understand and are able to submit to this NOSI if you are interested. The NOSI uses the standard review criteria as described in each of the eligible R01 funding opportunity announcements. These standard criteria include significance, innovation, investigators, approach, and an environment. Additional review criteria and considerations include study timeline for clinical trials, other aspects, and of course, check the FOA for resource sharing plan requirements. With that, I will pass it on to my colleague, Erica Breslau, who will answer some of these common questions that we've already received from potential applicants.
Hi, this is Erica Breslau. And this first question that we received prior to the webinar was, where can I find more information about NIH NOSI? There is underneath this first notice, NOT OD 19107, NIH expanding use of notices of special interest, was issued on June 14th, 2019. I suggest you go to this website. And then another place where you could find out more information on NOSIs is underneath the NIH NOSI frequently asked questions, which describes a NOSI and how NIH distinguishes applications submitted in direct response to an FOA from applications submitted in response to a NOSI that uses an FOA for submission. So a typical question might be, can I include an assignment request when I submit my application to a NOSI? And the answer to that is yes, of course. The next question that we've received is, what is a cancer care continuum, and how does that relate to my application? So for purposes of this NOSI, as Wynne described, the cancer care continuum includes the following phases: detection, diagnosis, treatment, survivorship, and end-of-life care. We're also looking at the processes that occur in between each one of these demarcations, and you may, of course, include one or more if this is part of your study design. However, applications must focus on one or more phases of the cancer care continuum that I've just mentioned. And applications that focus on other aspects of the cancer care continuum, such as etiology, prevention, and I would add a question that we've just received, such as policies and policy mandates, would not be considered responsive because they're not really part of the cancer care continuum. They're somewhat external, and generally NCI does not fund, and I might be right off base with this, policy-related applications. We're going to think about that. And then the third question that's just come in is, what are clinical practices? These clinical practices are practices, programs, treatments, or interventions delivered along the cancer care continuum from detection to end of life. We just received another question, which was, can you clarify if an intervention has to be active or prospective? And that's a little difficult to answer, but I would say it could be, I'm not sure what is meant by active, but definitely your study could be a prospective study. And the person who asked this question, maybe you could send us a follow-up question explaining what you mean by active. The fourth question that we've received is, what clinical practices along the cancer care continuum are considered to be ineffective or low value? And we would say that that determination should be made by the research team writing the application, and I would say that you need to justify this in your significance, and you need to be sure to cite literature as to why it's going to have an impact on the field. Applications need to explain why the proposed clinical practice is considered ineffective or low value. And this actually will be looked at carefully by the review panel underneath your criteria, as I just mentioned. Potential resources for identifying candidate clinical practices include interventions and recommendations made under Choosing Wisely, the Clinical Practice Guidelines, the U.S. Preventive Services Task Force, and professional society recommendations. So resources. A recording of this webinar will be posted on our website approximately in 3 weeks. And you can also go to our webpage that's listed here for the Healthcare Delivery Research Program and the Implementation Science Program. I will also say that the slides will be available and on both of these websites, and also more frequently asked questions that we've just gone over and those that we've received both from this particular webinar and prior webinars, we will post answers to them. Submission inquiries should come to either myself, Erica Breslau, or to Wynne Norton. And if you have a financial grants management question, then you can contact Carol Perry at this email address. So now we're started to receive questions from our listening audience, and we request you to send more questions in. Okay, just to clarify is a question, would studies around screening or surveillance, for example, in those with colon polyps, be part of the cancer care continuum? And the answer to that is absolutely.
Another question we just received, and thank you for submitting them and keep them coming. Implementation Sciences uses very specific terminology and methodology. Is the expectation for this NOSI that similarly rigorous methodology will be used? Yes, and a comment here that a lot of the different methods and study designs that one sees in implementation science are found across various disciplines as well. So your experimental, your quasi-experimental, and variations thereof are found in a lot of disciplines and therefore would be applicable to this NOSI studying de-implementation, again, depending on the research question that you have and the extent to which that study design and those research methods are able to answer or best answer those questions compared to other designs. We encourage you to define and be very specific around what types of study designs and research methods you are using in your proposal.
We've just received another question about which study section to send the applications to. And our guidance is that we encourage you to look at the Center for Scientific Review website to look at their standing study sections and take a look specifically at the general content areas and the purpose of that study section and the current roster of panel members. For example, some of our applications have been sent to Health Services Organization and Delivery Study Section, HSOD. Others have gone to PRDP. Others may go to Implementation Science. But we encourage you to look at the CSR website and to try and make your own decision and then run that decision by either Wynne or myself, and we can help you sort it out.
One more question here asks, are you interested in, as in the NCI, in specific examples of de-implementation along the cancer care continuum, or are you more interested in methodological developments? I would say that we're interested in both. To the extent that de-implementation is relatively understudied to date, we are interested in exploratory and or hypothesis-driven applications. And of course, if you have a methodological development because this is sponsored by the NCI, you would want to make it applicable to and within the context of cancer care continuum.
The question has just come in, multi-level interventions required, and the follow-up to this question is, will interventions targeting only one level, such as the patient level, be viewed negatively? We're not requiring multi-level intervention, but we do know a lot about single level, such as the patient or the physician level, and we're encouraging science at NCI that includes studying two or more levels of the healthcare system and looking at interactions and mediators and moderators between the different levels.
Question, low-value care refers to services rather than clinical outcomes, for example, death. Are clinical health outcomes required to be studied? They are not required to be studied. The only requirement is that it focuses on one or more of the phases across the cancer care continuum. But we do encourage you to consider clinical health outcomes to the extent that it is able or critical for answering the question or exploring the issue that you are proposing to explore or answer within the context of your application.
There was a request here for Wynne Norton's email address. It's Wynne, W-Y-N-N-E, period, Norton @nih.gov. An example, we have a question, can you provide an example of a multi-level intervention? A multi-level intervention would involve, for example, intervening with the patient and, say, the clinic, the provider clinic, to look at the way, and I'm going to give an example. We had a funding announcement out on de-implementing or stopping the use of over-screening older adults. And we realized that cancer screening is a process that involves far more than just the test. So we were asking folks to look at what parts of the screening process were applicable to over-screening older adults. And in this case, it would involve the individual patient who's being over-screened and potentially decisions that are being made at the clinic level and how they are what interventions are being designed both at the clinic level and the patient level to ameliorate this behavior.
Question here, do we need to develop the intervention or can we evaluate an existing intervention for the application? Just a point of clarification here, we're talking about clinical care practices and practices encompassing the intervention, but essentially thinking about what is being delivered to a patient or collection of patients by the provider, the team, the system, the organization, etc. So the intervention here would be some type of practice being delivered. So the development of the intervention wouldn't be applicable within this context. I think the question here is more applicable, and this is a terminology issue, which of course you want to make sure to be very clear about what you're talking about in your application. But the intervention, I think, here is really a reference to a strategy or collection of strategies that support de-implementation. And yes, we certainly accept and welcome applications that focus on how to best de-implement particular practices, which may be either prospective or retrospective data analysis, perhaps using an interrupted time series design, looking at particular reimbursement changes and how that may have an impact on reducing or stopping or replacing the use of ineffective or low-value practices.
We have a question that's just come in. Do we need to, okay. Here's a question about whether reviewers on the study section will be aware of the NOSI and its relevance. Or does the NOSI need to be explicitly denoted within the body of the research proposal? The scientific review officer and the chair of study sections will be notified of NOSIs, and there will be an explanation given to reviewers. So this was a really great question. That's a review question, and we'll make sure that this is passed on.
And that will be contingent, of course, on the specification in the agency routing identifier of the NOSI and the correct number. So make sure you check and double check that that number is correctly into your application when you submit it.
So this is all the questions we've received. If you do have additional questions, you can send them in, and Wynne and I will prepare a written FAQ that will also be posted on this website. And we really appreciate your attention this afternoon, and we look forward to reviewing your applications as they come in and supporting you.
Thank you very much.